All right, I'm joined today with Glenn Dow, and we're here talking about Hospice on the Border Society. Glenn, thanks for taking some time to talk with me today.
You're very welcome.
So, first of all, can you just tell me a little bit about Hospice on the Border?
Well, I think most of the people that we will get an opportunity to speak to will recognize the word hospice, and it is a place of comfort near life-ending circumstances and situations where there's terminal illness and other things like that. And there's a short period of time of expectation. And most people have two choices. They have a choice of currently in Lloydminster, a hospital bed that could be assigned, or you may choose to expire at home. We have several people that have gone through both of those experiences, and some people would like a place that was more like a home but had more medical services. At the same time, they're not crazy about a hospital bed. And of course, coming through this COVID challenge, where there were people that were at end of life situations with their relatives not being able to visit or their family, and the challenge around maintaining hospital security related to the virus was difficult. So we thought it was a timely project. The project had actually begun probably 2 years ago, looking and thinking that it would be a good thing to have because many people need it. They want their loved ones to be in a nice, calm, home-like environment, but they prefer it wouldn't be the hospital.
So, how far along is this project right now, and do you need maybe support from members of the community to help kind of kickstart the campaign?
Well, we will shortly. Right now, what we have done in Saskatchewan is that the Saskatchewan side of the border has two hospices that are underway. One in Saskatoon, I understand, operational, another one in Prince Albert to be built. And so we thought we should inquire initially as to whether Lloydminster would be another appropriate place to be able to put some Saskatchewan government funding in. And the advantage of that is that really you look at the hospice beds that are assigned in Lloydminster, which is usually about 3 at the hospital, but sometimes you have patient counts in end of life situations at about 6. And so our goal is to see if we can provide that kind of facility that would cover up to 10 beds for that kind of situation. So just following up on what you were asking about how far along are we? Well, we started 2 years ago, but there wasn't any funding in place for operations. And we can't handle operational funding locally in terms of the cost on an average daily basis. But what we can do, as we've always done in Lloydminster, is we probably can do the bricks and mortar. So we probably could do the capital cost if we could secure government funding. So what we're doing right now is basically we've touched base with Saskatchewan Health Association. And then later in the year, we've touched base with the MLAs just after the election here to see how that would be a possibility. So they are weighing our requests right now for funding for operations. And we are busily working on the rest of the program in terms of the building design, possible locations, the staffing, which would be about 18, the number of beds, which would be about 10, and trying to get everything else in place so that if we did get a yes from the government, that funding would be available, say, in 2022 or something like that. Then we could start working locally to acquire the funding, the assistance, and start the program so that we have a hospice ready to go within probably 2 years of having a funding announcement. That's where we are.
So, do you need, if people are interested in supporting you guys or helping you out, is there anything you need right now, or are you guys waiting for that approval from the government of Saskatchewan?
Yeah, we're waiting for that approval. I think the earliest we will hear is probably after their budget, so it'll be late March, early April.
Mhm.
That might give us some, hopefully it's not a maybe or there are other things to do. We'll probably have a few conversations between now and that time. Uh, we didn't want to go to the public until we've definitely secured operating funds because there's only so many projects a place, a city like Lloydminster and surrounding area can absorb. And of course, if you get it partly funded and the money is sitting there to operate it, but the money is sitting there for the bricks and mortar, but you don't have the operating funding, then it sits in limbo or gets targeted to another project. So to be very easy on the public and do the right thing, we thought, okay, let's work on the funding side. Let's work on the logistics of how this could be done. And then once we have the funding secured, then we can certainly roll it out to the population and let them know.
And you mentioned it a little bit more earlier on, but can you talk a little bit more about kind of the need that there is here in Lloydminster for a hospice like this?
Well, I think it's been expressed by physicians at times that they wish they had a place. Almost all of us that have reached a certain age have parents that have retired either at home or in the hospital situation. And so around the community, we find, as we do in all communities, that we're looking for better end of life circumstances and situations. And I think it's especially come true with this COVID situation. If you could be a little more flexible with family, that would help out. It also has a cost saving factor in that the hospice beds will be probably the cost of hospice beds that would be paid by the government are about half the cost of the palliative care beds in a hospital. So that would be some saving in terms of that portion. So those are kind of the things that triggered it: a need, a desire that we could save some money and open up some beds in the hospital. That volunteers that like to be able to visit and encourage, there's an opportunity for them. We're looking at a staff of about 18. We're looking for many volunteers, but of course, we're still waiting for a yes from our provincial counterparts before we can get underway.
All right, Glenn, thanks for taking some time to talk with me today. And once you guys get some more information and more approval from the government, I'm sure we'll follow up again and find out how things are going with you guys at the Hospice on the Border. Thanks again for talking to me today.
You're very welcome.